It is a pain that can strike in the middle of the night. By age 65, nearly 25% of the population is affected by it, and many don't even know they have it. Peripheral arterial disease is a common yet serious disorder that, if left untreated, can result in critical consequences.
PAD is blockage in the arteries, which comes from buildup of cholesterol and plaque in these vessels. It's important for people to know that they have PAD even without symptoms. When they don't have symptoms, the presence of plaque in the legs still puts them at higher risk of dying from a heart attack or stroke than someone with stable angina or stable chest pain. Mild symptoms may be pain with walking longer distances. Moderate symptoms may be to the point that they can't walk half a block or a block without having leg pain. CLI, or critical limb ischemia, is the furthest form of the disease, and this is when patients present with pain at night in their feet or tissue loss such as gangrene or ulcers in the feet. These individuals are at risk of immediate limb loss if intervention is not undertaken sooner.
Even if you are asymptomatic, scheduling an appointment with an expert is the first step in getting a proper diagnosis. Simple physical examinations and non-invasive tests are performed to see if a patient has the disorder and at what stage the disease is at.
The testing that we use to help includes non-invasive vascular studies, where they'll put blood pressure cuffs on the leg in multiple different levels, including the ankle and sometimes the toe. That gives us blood pressure information as to how much flow is getting to the foot versus how much gets to the arm. That helps determine the degree of decreased flow.
Interventions and medications to treat PAD vary.
With people who don't have symptoms or have mild peripheral arterial disease, we'll treat them with medications and lifestyle modification. That includes number 1, 2, and 3, not smoking. That's one of the most critical aspects of PAD. Number 2 is exercise, which actually improves the circulation to the legs and improves the symptoms. And 3 is some medications that we can use which can improve the circulation, and that's something that the vascular surgeon will prescribe along with the primary care physicians.
Once we see the patient and even if we don't intervene on him, we want to follow up and see if there is any progression of the disease. We want to work with the primary physician and the patient to convince them to make some lifestyle changes which will hopefully halt the progression or stop the progression of the disease.
Patients with moderate disease cases may benefit from surgical or endovascular intervention if medical management is unsuccessful.
That's when we progress on to angiograms and other testing to determine whether or not we can fix it with minimally invasive techniques such as angioplasty and stents.
The greatness of these endovascular procedures, it's really very easy on the patient.
And in cases of critical limb ischemia, intervention is necessary. The intervention may require open surgery, endovascular interventions, or hybrid interventions, a combination of open and minimally invasive techniques.
A hybrid procedure is a combination of using the best of both worlds. There are some patients whose anatomy is really not amenable to just minimally invasive techniques because of where the blockages are. So a portion of this is best done open. And a perfect example is someone who has bad blockage right in the groin artery, but also has some blockage in the belly. The groin artery is best dealt with in an open procedure with cleaning out the plaque from that area. The artery in the belly can often be treated by putting balloons and stents in that area. Then we've decreased the operation for the patient. They can go home in 1 or 2 days instead of a week, so it's less invasive for the person, yet we're fixing both parts.
My primary physician told me about Dr. Harris. Dr. Harris did inform me that because of where the blockage was, that if I didn't have surgery, that there's a good chance that I may have to lose part of either one or the other leg, you know. To me, that was unsatisfactory. Before the surgery, I had difficulty walking for any distance or doing any kind of labor that walk. After the surgery or whatnot, not right away, but after a month or so, the difference was like night and day. Night and day, a really great recovery, and I couldn't believe it myself, you know. So I had to not try to do too much at once.
Years ago, patients diagnosed with peripheral arterial disease would have had grim treatment options. Today's advances in medicine have given new hope to those who want to continue to live life to the fullest.
I can cut grass again without stopping so often. And it's just more comfortable for me. I can go to the mall and walk with the wife, without stopping and so forth, So I'm really pleased with it, and I feel better.
There are many changes in vascular surgery, and since I've actually joined the field, we've gone from a field that was almost exclusively open surgery to one that combines minimally invasive with open surgery. This has allowed us to operate on patients who are much sicker. And what this means is people who otherwise would have lost their limbs and then ended up in a nursing home are now able to have less invasive procedures and to go home with their family and resume a somewhat normal life for them. And this is very gratifying to me. So keeping up with the changes and advancing the medical field in this way is a wonderful benefit for the patients. We're able to help and save more patients' limbs, and that makes a big difference.
The dedicated staff at Kaleida Health is here to help you overcome peripheral arterial disease, a condition that can lead to critical limb ischemia, a crippling outcome if not caught in time.
The major impact on the development of the disease is the prevention. And I think the prevention of the peripheral arterial disease should start very early on, and particularly in the patient who have risk factors, either hereditary history of peripheral arterial disease, or if they develop other form of arterial disease or hypertension, hyperlipidemia, diabetics. Prevention of the progression is extremely, extremely important.
Symptoms can vary, so it's important to seek the advice of a qualified vascular surgeon if you think you have the disorder.
You never know what you can do or what you used to do until you cannot do them anymore. And I feel like I can do things I know that 20 years I could do.
The bottom line is that we attend the patient during rest of their life, basically. So that's how the vascular surgery practice works. So we become kind of primary physician for the circulatory problems.
Kaleida Health, we're here for your very best health. If you or someone you know suffers from peripheral arterial disease, visit us at KaleidaHealth.org or call the number on your screen.